It was amazing. I just felt so good because she was young. She had she wasn't told what was put in her face. She didn't know what was going to happen, and she ended up coming out with a terrible outcome. And I was able to fix it for her and help her feel more confident about what she looked like on the outside because it was really affecting her mental status at that point.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Ashley Wilkins of Reveal Med Spa. She's a board-certified nurse practitioner with over 12 years of experience in the medical field. As a highly skilled clinician and aesthetic injector, Ashley is deeply passionate about helping individuals enhance their natural beauty while achieving realistic, balanced, and graceful results. Her approach combines artistry with evidence-based practice, prioritizing both aesthetic outcomes and overall health optimization. She has trained extensively alongside some of the most renowned experts in aesthetics and functional medicine, constantly advancing her skills to deliver the safest, most innovative treatments available. She is committed to empowering her patients with subtle, natural enhancements that honor their unique features, helping them age with confidence and grace. So Ashley, welcome and glad to have you here.
Thanks. Well, glad to be here.
Yes, let's dive right into it. How did you first get interested in aesthetics?
So I got interested in aesthetics back a long time ago in my early 20s. I had a girlfriend who worked with me in the ER. She was a PA and she was starting to dabble in the aesthetics world. And she needed people to come in and be her guinea pigs for her, starting out. So that's kind of how I got started. And I really liked it and I enjoyed and I learned a lot and got really interested into it. And at the time I was pregnant and me and my husband were getting ready to move. And that was one of my goals when we moved, was that I was going to kind of go down this journey of aesthetic medicine. And so when we moved to Hawaii, that's when I started, taking classes and courses and going to different conferences and learning more about the aesthetic industry.
Got it. Now, when it comes to the actual treatments that you perform, could you talk about some of the most common treatments that your patients come to you for?
Yeah, so I do quite a array of things, but most of the common things are neurotoxins like Botox, Dysport, Xeomin, all those. That's a very common procedure that most people are very interested in. I do a lot of fillers. A lot of people now are working on facial balancing, so I do a lot with that. And then I do a lot of hormone therapy. So those are my three big procedures that I do in my office today.
Okay. And is there one that's really special to you?
I really like the hormone therapy. I feel like that is my more newer niche. I've only been in with that for about 3-4 years. I feel like that's a part of our life, especially as females, that is lacking. We don't get a lot of help with that when we get to that perimenopausal, menopausal, postmenopausal times in our lives. And I enjoy watching my patients love life again, and watching them not be so depressed and wondering why they're so anxious. And I would have to say that's probably my most favorite part of my job, is helping women get through that life.
Okay. So could you talk a little bit more about that? Whereas what is hormone therapy? What are and you kind of touched on this already, but like, what are the situations that they'd be feeling, that they'd be experiencing, where they would really need this and can really benefit from this? Could you dive deep into what it is, and then at what situation would someone really need this?
Yeah, so I do bioidentical hormone therapy. I've done all kinds of hormones. I've done injections, creams, suppositories, all of that. I really enjoy pellet therapy. And so that's kind of where I've kind of moved my niche to right now, is all doing more pellet therapy. Women really start needing this the biggest complaint I get from most women is they come in and they're just, I don't feel like myself. I hate my husband. I hate my life. I hate everything about me. Everything makes me mad. I just feel like I'm crawling in my skin. That's pretty much the synopsis of what everyone kind of complains of at first. And so, it kind of hits women at different ages. We're seeing a lot more women in their mid 30s, early 30s looking into hormone therapy. And so I tell people, I'm like, okay, well, when you're kind of having those feelings, most of the time they've gone to their primary care physician or they've gone to their OB/GYN, and they're just being told, oh, you're starting that change of life. Let's do an antidepressant. Let's put you on birth control pills. And they start going down this and they're like, this is not working. I still feel terrible. I still, don't like everything about my life is just miserable. And so, we start diving into that and we start discussing, well, maybe this is a hormone problem. Maybe there's some things we can do to help kind of make it a little bit smoother of a process for you as you go through your perimenopausal, menopausal, postmenopausal stages. And so those are my biggest thing. Women will talk about being just exhausted. They're not sleeping. They're having, hot flashes, sometimes headaches. I get a lot of women with headaches, no sex drive. Their libido's just dumped to the bottom, and they're just angry, they're like, I don't know why, but everything I do just makes me mad. And so, I tell people that's the signs. These are signs. And so then when these women come in, we look at all kinds of things. We look at their hormones. We're looking at like a full panel. I look at everything to try to figure out kind of what's going on. But most of the women, you'll hear that they're just, everything makes me mad. I want to kill my husband. I don't like him. I don't, I just want to leave and go somewhere else. And so that's normally the first kind of talk we get when we start diving into hormone therapy.
Got it. Now, from what I've been seeing in the space, it seems like the hormone therapy is still relatively new. Now, are you kind of seeing this as one of those really big emerging treatments, and do you feel like your patients are aware that this exists, or that they know that they have these issues and they just don't know what the answer is to fix it?
Well, it's funny because I was just discussing this with a patient the other day, and she was like, I feel like my generation's the generation that hormone therapy is like becoming prevalent. And I totally agreed with her. I feel like this is a new and emerging. It's been here for a long time, but it's not really been brought up. It's not been a subject that we actually talk about. I talk to women of all ages, and a lot of my more mature women say, these were the things my mom talked to me about. My mom didn't tell me about this. My mom didn't tell me I would feel this way. And so I feel like now it's becoming, our generation is more into biohacking, trying to age gracefully. Everything's very natural now, and I think it's becoming hugely prevalent. I think you're going to see more people talking about it. I think it's going to become, I think over the next couple of years, I've been doing hormones for probably about 4 years now. And even in just those 4 years, I have seen a huge jump in people actually talking about it and, saying, hey, it's okay to talk about these things that are going on in our life. And what can we do to fix them? We live longer now. More people are active in their 60s and 70s than they were 20 years ago. So, people are wanting to enjoy those years of their life.
Mm-hmm. What do you think is the potential for this type of treatment? Do you think it's going to be something that is going to, I guess, number one, extend your lifespan, or number two, extend your health span, where you actually can enjoy those older years with a higher quality of life, or just something else? Like, how do you really see where this can help people and where it's going to go in the future?
I think it's going to become more of a thing talked about, and I do think it's going to. I think both. I think it will help extend lifespans, and I think it will extend quality of life in those health spans. Hormones, are being really studied and brought back into like the mainstream media right now, and they're discussing like how it's cardioprotective, it's neuroprotective, it's actually uterine protective, all these things to help protect us. And it helps with like Alzheimer's. People are actually like discussing the benefits of hormone therapy now more than the negatives that they've always been told about. I know a couple of weeks ago, FDA just pulled the black box warning on testosterone. That was a huge thing for the whole medical field. We were expecting it, but we just, we didn't think FDA would ever, say, yes, it's okay. It does actually protect the cardiovascular system when used correctly. And so I think it's just going to like help. I think it's going to do both, honestly. I think both things are going to happen. We're going to see a lot more people discussing it and using hormone therapy.
Okay, that's great to hear, because I know that regenerative medicine was also kind of one of those areas where the FDA was really
Yeah.
like it, and then was like banning everything left and right on it. But it seems
Yeah.
there's more and more regenerative medicine, functional medicine, hormone therapy, like all that's starting to come more and more prevalent. And it's good to see that even the government agencies are starting to loosen up a little bit more. I think it's just as people continue to push on it, do more research on it, more and more consumers start to use it and see the benefits of it, I think things will start to loosen up a little bit more, which I think is
I
fun.
agree. I think so. I think it's all just going to be better for our generation and the next generation when it comes to healthy lifestyles.
Yeah. Now, actually, I want to dive a little bit deeper into your practice. How do you really differentiate your practice from others in the industry?
Yeah. So our practice, we are very patient centered. I tell people, like, when I practice, I want my patients to feel like they're at home. I tell people, when they come in, we talk about, it's like, I tell them it's really a therapy session for me, because I just sit there and tell them all these random facts. And so people just laugh. They're like, I don't even know what happened. Everything was so nice because you just kept me so entertained the whole time. So all my patients have a patient focused plan for just them. And sometimes everybody is always wanting to improve the outside, but sometimes I'm working on also the inside, like helping them feel comfortable in their body. So I think that's kind of sets us apart from everyone. People come in and I tell people, I'm like, I know about your dogs, your animal, your husband, your kids. Like, it's just a fun session instead of just, I feel like the aesthetic industry has become almost like a assembly line. Like, you just come in, get your shots, get out, goodbye. And they don't really know who you are anymore. And that's not how it is in my practice. I want to know you're a friend. I tell people, like, you're a friend. You're a patient, but you're also my friend. So that's how I treat. I think that sets us apart.
Yeah. And you hit on one point that I want to dive a little bit deeper into. You were talking about it's not just about feeling good on the outside, but really about feeling good on the inside.
Yes.
I think that's one thing that when people think about, like, your average person thinks about the aesthetics industry, they're only thinking about the outside part. They're not thinking about the inside part. Like, how are you able to help people so not only their health is better, but also maybe their self-image is better? Because I think there's a little bit of that, people go get aesthetic procedures done just because of vanity.
Right.
Very often it's not. That's actually probably the exception.
Yeah.
It's people that just want to feel normal. They just want to feel like themselves again. Would you agree with that?
Yep, I concur with that. I agree completely. I always tell my patients laugh because I tell them, like, my goal is when you look in the mirror in the morning, you go, oh my God, I look fantastic. I feel great. Because I tell them, as long as you feel good on the inside, you could walk outside in the most ridiculous outfit in the world. And as long as you are holding your head high and you feel great, everyone else is going to take that aura off of you. And they're going to realize, man, she's a good looking woman or a good looking man. Look at how confident they are. And so that's my goal for all my patients, is I want that confidence from the inside to shine on the outside.
Now, how do you approach educating your patients about the services you offer and the benefits? And if you can kind of break down from the injectable side and the hormone replacement side, I guess those are kind of two different things.
Yeah. I always tell people I give way too much information. I tell them, like, I'm going to just overload you. And if I do, just tell me stop. I break everything down. I tell people we start from, I tell them how you're going to sit down in this chair. This is what's going to happen. I'm going to do this, this, and this. I break it all down. I break down from what you to expect during the procedure and to expect after the procedure. I always tell people I kind of give them all the bad so that when they do sit down and the procedure's done and it's over with, they're like, oh my gosh, that wasn't that bad. And I'm like, yes, that was the whole point. Everybody, I tell people, it's always the unknown, right? Like, if you've never had these procedures done, it's always the fear of the unknown. It's a natural human response. And so I tell people, I'm going to give you the worst that could happen and the best that can happen. And that way you at least know. And so when everything goes fantastic and it's beautiful and you didn't feel a pinch or a sting, you're like, oh my gosh, that was it. And I'm like, yes, that's it.
Oh,
Even with my hormone therapy, I tell them, I give all the good, the bad, the uglies, and all the greats, best, and excellence that come with everything. Because I just feel like I run into this a lot. I feel like I get a lot of patients that sit down in my chair and they have no idea what's put in their face. They have no idea how much was used. They just know that someone told them that they needed, this, and this, and they got charged $4,000 or whatever for it. And so I tell people, I feel like that's a disservice that a lot of providers in the aesthetic and medical wellness industry do. We just don't inform our patients of what's actually being used on them. And I'm very thorough. I want everyone to know, and I tell them, hey, if you don't remember, I will jot it down because you should know these things. And even with my hormone replacement therapy patients, I tell them, I'm like, here's how much you got, here's what was placed, where I put it, what to expect to right now, tomorrow, in 3 days, in 7 days, in a week, in 2 weeks. I am just very thorough. And I always tell my patients, anytime you have any questions, please just call me, text me. I'm like, I'd rather you ask me than sit there and worry and not know.
Mm-hmm. I see. Now, throughout all that, when you're explaining, or when you get people that come in to see you, I'm sure that they have a lot of misconceptions about what you do and are just wrong information. So could you share some of the most common misconceptions you hear from your patients about what you provide?
Yeah. One of the biggest on the aesthetic side is that all tox is Botox. Everyone thinks that they've gotten Botox or Juvederm. And I'm like, that's not, and it's just because those are they're the longest standing in the industry. And so I always tell people, it's probably not what you got. And then, we have to kind of figure out things. That's probably the biggest thing. Nobody has really, I think we have done a disservice educating our patients that not all tox is Botox, is basically. And so that's my biggest one. On the hormone side, my biggest thing is everyone thinks testosterone is going to make them super bulky and their voice change and all this stuff. And so I always have to kind of go over that with my women. The men love it. They're like, yeah, I want that, but my women are always terrified of that. And so we have to kind of debunk that. And I have to let them know, hey, that's not what we're doing. That's not our goal. That's not what we're trying to, get in the end goal here. And so explaining that and getting them off that ledge of thinking that they're now going to transition into a man is always the hardest part. But once they realize, hey, that doesn't happen. And, I tell them, I have a patient, she's been doing hormone replacement therapy for 40 years. And she's the most feminine looking woman I have. She's 89 and just killing it at life. And so, we have to kind of go over that. And I tell them, you just have to calm down. It's not going to happen like that.
Have you found that you get some people who, I guess, let me take a step back here. When it comes to the hormone replacement therapy, is it something where it's largely going to be applicable to any single person? Or do you find that there's a lot of personalization that goes into it? One thing that you mentioned was the testosterone. Guys think that, testosterone will make me buffer, more muscle, more lively, better sex drive. But do you find that it's going to be very individual? Some people may need it, some people may not, or is it kind of a broad stroke? It's going to be helpful for everybody.
I think it's individualized. I do believe testosterone helps a lot. It does overall help most people, but it's very individualized. I try to be very individualized with all my patients on their dosings, because I don't feel it's like a one shoe fits all type thing. And so all of our plans, or all the plans I make for my patients, are very individualized and very, precise for them and their symptoms and what I see in their lab work.
Okay, got it. So I guess when people are actually getting the treatment done, how do you balance between providing that relaxing experience for them, but also making sure that their safety and well-being is there as well?
So, the procedure, when you place these, when I do the hormone pellets, it's a sterile procedure. So, everything's very clean and done professionally and together and by, evidence-based practice. you just have to kind of talk. I tell people, like, talking to someone really helps get that brain to not focus on what's happening. The procedure is not very painful. The worst part is the numbing, the lidocaine and bicarb. And so I tell them, you're gonna get a little pinch. It's gonna feel like I'm stinging you like a bee. And then, I just talk to them. I tell them jokes. I divert their brain from thinking about what's happening by just giving them random stories that has happened to me that week or whatever's on my mind. And so most of the time, I had one lady, and she actually was like, can I take a phone call while you do this? And I was like, for sure. And she was like doing her phone call, and I was just sitting there, and she was like, are you done? And I'm like, yeah, I'm done. Your procedure's done. You were good. She was like, I didn't feel anything. I'm like, the brain is a great thing when you divert it from what's really happening to the body at that point. Diversions help. So
Okay, so you make it as painless as possible for them.
yes.
Okay.
I was told one time that my hands were very what does she call them? I had sleight of touch. She didn't even know I was there.
That's an amazing compliment, especially when it comes to needles.
Yes. I tell them all the time, I'm like, it's because of my ER background. Like, when you've worked in emergency medicine and trauma for years and years, I'm like, you put needles in places that they should never go. So
Well, you're an expert on that then. Now, actually, I want to dive a little bit deeper into something that was mentioned in your introduction, as far as where you combine the artistry and the procedures, like there's the protocol, the process, the evidence-based practice. Because I think that's one thing that people don't really realize when it comes to aesthetic medicine, is that there's a mix of art and science that goes into it.
yeah.
And like you kind of already mentioned, like you already do both of them. But how important do you think that creativity, that artistic portion plays into aesthetic medicine?
I think it plays a lot. I tell a lot of people, not anyone can make anyone look fake, because fake doesn't take skill. You can follow a template and make anyone look fake, but the skill behind it is me to make you look like yourself, just more rejuvenated and refreshed. I think it plays a huge part in being in the aesthetic industry. I've been asked this question a lot, and I used to tell people, I think anyone can do it, but I really don't. As I have been in it for years, I don't really think anyone can do it, because it does take skill, and it takes being able to see things in a different light and different perception to make things look natural and normal, and not like it's, been overdone.
Okay. So if you had to kind of mentor somebody who was getting into the space, and they were actually really, really good from an art perspective, or really, really good from a science-based perspective, which one would you have to choose? I know I'm kind of putting you on the spot with this one. I know they're both important, but
art. I'd rather be really artistic. I can teach you the evidence-based practice and the science. I can't teach you the art. Like I tell you, like, that's the hardest part. I have mentored a lot of individuals, and teaching the art, I'm always like, I can't teach it. I always tell people, like, I think back about when I came from a small town, and we would go to art class, and they'd make you draw these things, and they'd be like, oh, but you're so good, and you're like, it's a stick figure, how is this good? And they'd be like, you're gonna get better, and I'm like, I don't know how this stick figure is gonna get any better. So I tell people, like, that's the hardest part, and I have had some people, and I've told, and I am very honest, and I tell people, I'm like, hey, you really have the science. You know everything. Like, your brain is so amazing to me. But the art part, we're struggling on. Like, we got to really work on that part.
Okay. Okay, got it. Thank you for sharing, Ashley. Now, I'm sure that throughout your career, you've had some particularly challenging cases that you've had to work on. Would you mind sharing maybe one story of a case that comes to mind of just, it was really tough, but then you were able to work through it and get them a really successful outcome in the end?
Yeah. So a couple years ago, and I remember this girl because she's absolutely fantastic and still, like, connects with me. I had this little girl come in. Well, not little, she was younger, female. And she had had some work done at another med spa, and she was distraught. She was very tiny, very feminine, and she had some work done to her lower face, and her lower face ended up being very square and almost, it was very masculine looking, and she did not have that type of face. It made her, if you had took a picture of her face, it made it literally look like she was 20 years older than what she was, and she was in her early 20s. She had a very small chin and just wanted some more definition to it, just to kind of give her face a longer look, and it had come out square. And she was really distraught. Came in to see me. I don't even know how she found me, and she sat down and we were talking about it. She had no idea what was put in her face. Just knew that she had paid for 3 syringes of filler and that was the outcome. So I had asked for like befores. Let me see what you looked like before, from all different profiles, and I knew what she looked like then. And so we just kind of I had to kind of figure out what had happened. And she was just really sad. She was like, I look bulky. This is not my face. It didn't fit her ethnicity, didn't fit anything about her. And so we went in and we fixed it, and we made her chin very feminine, very short, very like more pointed, very feminine V-line look. And I mean, she started crying right away. She was like, oh my God, I look so much better. I was so ugly and hideous. I was like, you're hideous, you're beautiful. But, seeing her she was so distraught, and watching her be happy again was so happy, just made my day. And, she thought she was going to have to pay for all this stuff, and had just settled on that it was going to cost her so much money. And I was able to actually do it with a fraction of what she thought, a third of what she thought she was going to have to pay. And she went home, she wrote all these reviews, posted all over social media, was tagging me, sending me text messages, thanking me for fixing her life. She was like, I had been wearing scarves to hide my chin, and now I can go out and be back to myself. And I want to say with her, she stayed my patient. She would still be my patient if I still lived in Texas. She texted me not too long ago, was like, can you please come back and help me? But it was amazing. I just felt so good because she was young. She wasn't told what was put in her face. She didn't know what was going to happen, and she ended up coming out with a terrible outcome. And I was able to fix it for her and help her feel more confident about what she looked like on the outside, because it was really affecting her mental status at that point.
Yeah, no, that's a fantastic story. And again, kind of like as we talked about before, a lot of it's just they just want to feel their best self. It's not about, oh, I want to be the most beautiful person in the world. I just want to be my best self.
Yeah. And it was really affecting her. And she was very young, and, young people are cruel to each other. And so she was, having to deal with that. And so it was really exciting to watch her be happy again. And, and she just, it was amazing. I was so happy for her. It was such a small thing. People don't realize their chin. Yeah. Who would think that would be something that could cause so much distress for someone, but it did.
Yeah. And you were able to get her a great outcome in the end.
Yes. She was so excited. She's so funny.
Now, Ashley, where do you think the future of aesthetics in general is going?
I think we're going to the whole, I don't really like this term, but the biohacking, I think that's kind of where the aesthetics world is going. Everyone is wanting to kind of age gracefully. It's not about not aging at all. I think we do want to have some aging happening, but we're all trying to age gracefully and as slowly as possible. I think is how it should go.
Yeah. Or with the best quality of life, right?
With the best quality of life, yes.
Yeah. Okay, great. Well, actually, I have one last question for you, but before I ask it, I want to point people to your website at revealmedspas.com. Yes. Now, last question is, what is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
So I would say do your research. Go in and have a consultation. I do think social media helps, but I tell everyone, don't trust social media, okay? We can doctor pictures so easily now in our web space that don't trust always social media. Go in and have a consult with that person. See what they actually know in person, because I tell people, I can make anything look great on paper. I can make anything look fantastic on a piece of paper, but coming in and actually having a conversation and sitting down with that person is a whole nother game, is a bigger game changer, because it's harder in person to know how good they are. I think that's what I always recommend that. I always tell people, hey, go in and discuss. Go in and sit down with that person and talk. You can go on social media and look at like their befores and afters, their reels, their stories, whatever, but you're not going to really know until you go in and sit down with that person.
Okay. Well, there you have it, Ashley sharing her expertise. So Ashley, where can people contact you in your practice?
They can contact me. You can go to either our Instagram at Reveal Med Spas, or you can contact me on our webpage. You can go to info@revealmedspas.com, and that shoots it right into one of my mailboxes.
Great. Well, thanks for being on the show and sharing your message, Ashley.
Yes, thanks for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.